The next award is for the category of working seamlessly across organisations. The first finalists in this category is Hywel University Health Board and Dyfed Powys Police for their work to improve support for people experiencing mental distress. Concerns had been raised around the increased number of people being detained under the Mental Health Act, the high use of police cells as places of safety while they wait for assessment, and the time taken to carry out the assessment. It was decided to bring together a mental health clinician and a police officer to triage 999 calls and jointly respond to people who were suspected of having mental health needs. The initiative has now been expanded into a year-long trial working with organisations including 3 local authorities, the Welsh Ambulance Service, mental health experts, substance misuse services and the University of South Wales. So a great partnership initiative. A number of improvements have already been noted, including better relationships between the police and health organisations, more sharing of information, increased understanding of mental health issues, and the provision of appropriate care. The second finalist is Powys Teaching Health Board for a partnership project to provide services in the community for patients with lymphedema. For patients in Powys, lymphedema treatment was particularly challenging because of the rurality and poor transport links. It was decided to develop a new specialist service in communities where patients could receive treatment, share experiences with others affected by the same condition, and access a wide range of self-help groups and information. The Health Board worked with Bracken Trust, a cancer support group in Mid-Powys, 10 of us, community nurses and Powys Leg Clubs to provide a more seamless service for patients. The service is provided in a number of venues, has been welcomed by patients and is providing improved care closer to home. The third finalist is Aneurin Bevan University Health Board for their project with Red Cross Transport to help patients get home quickly and safely after being discharged from hospital. A Red Cross crew and ambulance were funded to provide transport from units in the Royal Gwent Hospital and Neville Hall Hospital. Red Cross crews were trained to the same level as Welsh Ambulance patient transport crews, and they take patients home and check they're settled before they leave. The service worked so well a second crew has already been recruited, and more than 750 patients were transported just during the first 4 months with no complaints and excellent feedback from patients. The initiative has reduced the length of time patients had to wait to be discharged and has enabled more inter-hospital transfers to take place, ensuring patients are treated in the right place at the right time. And now we're going to hear from Sian Bolton with her highlights of each finalist.
The main highlight of this visit was that there was a genuine desire by the staff to improve services for their patients, and the patients who were using the facility obviously demonstrated that it had made a major impact to them in that they weren't having to travel so far and that they weren't having to go into hospital. And the feedback we got from them during the visit was extremely positive, and they felt that it had made a massive impact to their lives. So the main benefit of this project was that it developed from a locally identified need, and it demonstrated true partnership working. It identified large savings amongst lots of partners in relation to patient flow, bed allocation and the use of the ambulance service, and the partnership demonstrated excellent relationships and mutual trust. So this project demonstrated excellent partnership working and thinking with joint language used by all. There were clear outcomes identified and lots of data to support the outcomes. All those who participated demonstrated strong values for driving people-centred service provision.
Thank you, Sian, and over to Andrew.
And the winner is Improving Care in Partnership Mental Health Street Triage Initiative, Hywel University Health Board and Dyfed Powys Police.